Today's presentation, of course, with Katie Krupka is Geriatric Care Management, Piecing Together the Puzzle of Aging. And I think it's something that a lot of us use. Oh, there's Jody there. A lot of us do use geriatric care managers, but Katie's going to go over a little bit of the benefits and the benefits of how to use a geriatric care manager and why people use them, right? If there's dynamics in a family where it's, maybe one family member doesn't agree with another, or she's going to go over a few of the benefits of utilizing, and then a few of the other things that she does. So I hope everyone is doing well, enjoying the warmer weather. Today is going to be absolutely gorgeous. So I hope you have a chance to get outside. I see Randy's actually inside. Usually she does some of these from her mobile phone because she's outside a lot. But I'm hoping that as the summer comes to a close, you were able to really spend good quality time with family and friends, because pretty soon we know the cold weather is coming and then the snow will fly, right? Boosters are here and we are feeling safer than ever. We have our booster clinic coming up on the 27th from 1 to 3 for the community. If you know any elder in need, we hope to be putting COVID behind us and moving forward, right, with strength and confidence. Oh, here's another person. Hold on. Okay. Let's see. We appreciate you being here, and I'm sure you'll have some great takeaways from Katie's presentation. I, of course, want to thank you in advance for any technical difficulties we may experience. We've been doing this for quite a while, but you never know what could happen. And of course, while I'm trying to navigate, there's quite a few people that are signed up. So while I navigate the waiting room, please be patient. It will cover what geriatric care management is and what the benefits are and the role they play and how they can help. So we're pretty much looking forward to Katie and all of her information. All of the lunch and learns that we hold are interactive, and there will be time for a Q&A at the end. To ask a question, either raise your hand or type in the chat section. We will get to as many questions as possible. What I want to do is give you a quick campus overview, and then what will happen is Christina, my colleague who's on the call, will give you a tour of Ruth's house, since this, of course, is where we normally hold our lunch and learns when it's in person. Christina will introduce Katie. Katie will present. We'll have our Q&A, and then I will pick a raffle winner. We've got a $25 gift certificate to the kitchen right here in Long Meadow. And if anybody from Eastern Mass wins, I've got a Dunkin' Donuts card, because I know that you may not be visiting Long Meadow anytime soon. Although if you do, you could get the kitchen one. Now, most of you already know me, and for those of you who don't, my name is Marianne Shelb, and I'm the Director of Business Development here at JGS Life Care. The JGS Life Care campus is not only a great place to work, but also to live or rehabilitate. With that said, I would be remiss if I didn't take this opportunity to share with you the Long Meadow campus. So if you hold on, let me actually just get to share my screen. Oh, somebody else is in the waiting room. You'll have to bear with me as I do that, but let me actually share my screen. Hang on. Okay. And I'm going to go over the campus and what we have to offer. Let's see. Hold on. Here's one of those technical difficulties I was telling you about. Okay. No, I don't think you could see that yet, can you? No, hold on, one more. All right, tell me if you could see that. Thumbs up. Okay, I got a thumbs up. Perfect. Thank you, Christina. All right, so this is the campus. We have 23 acres here in Long Meadow. A lot of people don't realize how many acres we have and what's on the campus itself. So I'll go over this quickly. We've got the Levitt family. We've got the Levitt family Jewish home, 24-hour skilled nursing home, including long-term care, long-term rehabilitation with secure care neighborhoods for our curious exit-seeking residents. Whoops. We've got the Sossin Center for Rehabilitation. Of course, this is the first greenhouse model of care in Western Mass, featuring 2 small houses, all private rooms, all private bathrooms, consistent care teams, all in a home-like setting. And if you look at the picture, it's got a picture of, the family members are sitting at the dining room table, and then you've got the, pendant lights in the background. You can't really tell, but there's, granite countertops. It's a kitchen that you or I would have. I believe the kitchen, the dining room table was even purchased from Pottery Barn. So it is all home-like furnishings, and it's a home-like residence. And if you've never seen it, it's a beautiful place to tour. So you'd have to let me know if you'd like to take a look at the inside. We've got Wernick Adult Day Health, right? This is an after, whether you're going to work or running errands, you want to make sure that your loved one is safe and cared for, but in a dynamic setting, which promotes social interaction and stimulation, while you could run your errands or go to work, and you're not worried about the person that, you're either leaving behind, or somebody that you just want to have like social interaction as opposed to staying home all day. And then, of course, Spectrum Home Health and Hospice, quality care that comes to you in your own home with personalized plans for each patient, because each patient is different. And then, of course, Genesis House. It's our senior independent living with efficiency in one-bedroom apartments located right on the campus, which gives them access to the family of services for the continuum of care. So it's like a CCRC, but it doesn't have any buy-in. And then we do have spend down options for the folks that are on our campus, which is also nice. And then last but not least, we've got Ruth's House Assisted Living. Of course, it's set back away from the main street with very private and wooded backdrop. And the Ruth's House Assisted Living, I'm going to stop sharing my screen, and I'm going to let Christina share, and she's got a tour that she's going to show you. So let me do this. All right, Christina, all you.
Hi, everybody. We made this video at the beginning of COVID, but it's still a great representation of our community. So I'd like to share that with you.
Surrounded by lovely landscape grounds and private walkways, Ruth's House Assisted Living in Long Meadow, Mass. is part of the 23-acre comprehensive campus of care at JGS Life Care, guided by Jewish values, serving all faiths. Ruth's House is a beautiful, home-like residence for seniors of all faiths who value their independence but may need assistance with day-to-day living activities. If your loved one is transitioning to a new lifestyle or needs extra care they can't receive where they live now, will make them feel right at home. Ruth's House offers 64 spacious, newly renovated apartments that residents can decorate and personalize. Residents can enjoy private or companion suites. Our residents enjoy 3 kosher meals daily, kosher snacks available throughout the day, and a country kitchen. Ruth's House features inviting dining and social areas inside and out. Other amenities include linen and laundry services and transportation to events and outings. All of this comes together to create a warm and inviting atmosphere that helps promote a strong sense of community for both residents and staff. Residents appreciate social and cultural events, including day trips to area restaurants, events, and attractions. Our memory care outings are specially designed for the enjoyment of our memory care residents. We also offer multi-denominational religious programming and spiritual support, including a rabbi on site. We believe independence is important, and our residents remain in charge of their own schedules. However, they can rest assured knowing our highly trained team is available 24 hours a day, 7 days a week to provide individualized care and assistance if needed. On-site nurses provide wellness programs and medication reminders. Primary care physician services are available on site, and a licensed nutritionist is available to discuss your dietary needs. Garden Neighborhood is a memory care secure neighborhood that has been designed to support the needs and perhaps more importantly the successes of each resident with early to mid-stage memory impairments and other dementia-related diseases. Our staff has come to know each of our residents on a very personal level and strives to accentuate skills and strengths that residents retain and not focus on losses. Daily activities are designed to create experience of success and reduce anxiety in a safe and secure environment. Assisted living at Ruth's House gives your loved one the care and support they need while allowing them to lead full and independent lives. We are committed to preventing the spread of COVID-19 infection and providing our residents, staff, and visitors with a safe and clean environment. We strictly adhere to the standards set by the state and federal government, as well as the CDC and the Mass Department of Public Health.
Okay, I'm gonna turn my
Thank you.
up. Yeah, and now I have. Can you hear me?
Oh, yeah, your volume is a little,
Something going on. Can you hear me now, Marianne?
that's better. That's better. Thank you.
Okay. So I get to introduce Katie today. Katie Krepka owns her own Home Sweet Home Senior Living Advisor and also works as an aging life care manager with Tecton Elder Care Management and Consulting. Katie has over a decade of experience working with older adults and their families. She is a gerontologist with a master's degree from UMass Boston, as well as a certified senior advisor and a certified dementia practitioner. Through an empathetic and consultative approach, she advocates for older adults and their loved ones to ensure they have the support and guidance needed to make informed decisions throughout their aging process. So thank you so much, Katie. The floor is all yours.
Thank you so much, and thank you, Marianne and Christina, for having me on today. I hope I can just give you at least a little bit of understanding of what geriatric care, aging life care management is, and how it can be useful for yourselves, your family, or your clients. I know there is a wide array of healthcare and aging services available, and we help and specialize in connecting kind of the dots and piecing together the puzzle. So basically, what is geriatric care management? Even when I sort of started doing the geriatric care management work, I had trouble kind of putting into words exactly what it is that we do, or what we can offer, and there can be some misunderstanding around it. So I kind of wanted to clarify that a little bit. And basically, what we do is we can help you and your loved one climb the mountain. So basically, help bring you to a place where you feel confident in making decisions for yourself or your loved ones or your clients, and providing you all the information and resources that we have available to get you there. So geriatric care management is also more commonly now referred to as aging life care management, and it's a holistic and client-centered approach to caring for older adults and others facing ongoing health challenges. So it doesn't necessarily have to be older adults. It can be younger people with disabilities or mental health problems, anybody who kind of just needs support managing the healthcare and aging and housing situation. The idea is to promote supportive and caring environment and promote healthy living. It is defined by the National Institute on Aging as one who specializes in geriatrics, or sort of a professional relative. And I really like the way that sounds, and using that as a reference. Especially for people who don't have loved ones, or loved ones are out of the area and out of town. So we can kind of be the boots on the ground for the family to help them manage all of the care needs their loved one might need. There's not a required certification to be a geriatric care manager, but many are either licensed nurses, social workers, gerontologists, and after a certain amount of time, you can get certified in care management. So overall, a geriatric care manager provides support, guidance, and advocacy for older adults and those with disabilities. So some things that aging life care manager or a senior living advisor can provide. We can help discuss difficult topics or complex issues on Alzheimer's and dementia. I also often recommend support groups, educational things through maybe the Alzheimer's Association, other communities that offer those educational supports to clients and their families, to kind of give them more information about the aging and Alzheimer's disease process, if so their family has those issues, and also provide the support through understanding that they're not alone in that, and kind of giving them encouragement to get along, because it's definitely not an easy process watching someone you love, age, and especially have Alzheimer's or a dementia diagnosis. As a geriatric care manager, we also make home visits and suggest coordinate needed services. So we can work together to kind of do an assessment and walk through the process of figuring out exactly what the client needs, what the family needs, and developing some sort of a short or long-term care plan, depending on what they're needing, and move forward from there. We also want to ensure safety and security through possible home modifications or durable medical equipment suggestions, and we would connect you to local resources that offer those services. Also, a main part of the job of a geriatric care manager or aging life care manager is to address emotional concerns. So we want to make sure, as I said previously, and it's a main part of what we do, is the families or the clients are managing, either a new diagnosis or struggling with behavioral issues, or just overwhelmed with the process, and to be able to kind of be a support and help walk them through that process is a main part of what we can do as a care manager. We also act as a liaison between families who are busy or live at a distance, or who don't have families at all. We can also help coordinate and hire in-home care. Make sure we connect with local resources of people, professionals that we trust, and work with them to coordinate between the families and the clients and the agencies to make sure that they have the proper in-home care that they need. We can also assist in bill pay. Usually that's more like lower level, but if somebody needs help just organizing their financial information, writing some checks, helping them get the things in the mail, we can help with those sorts of situations. We can coordinate medical services, accompany people to doctor's appointments if needed. We can make referrals for legal, housing, and community resources, and provide caregiver stress relief. And we can also review long-term care policies. So I'll talk about it in the next slide, but there's not very many funding options for usually geriatric care management is a private pay situation, but occasionally long-term care insurance policies will cover some of the services. So we can also provide as a service a review of the policy to make sure that you're utilizing that policy the best of your ability, and see if it will cover our services as well. And as a senior living advisor through Home Sweet Home, I can also provide and evaluate your living arrangement to help you determine if it's an appropriate situation for you. Arrange for respite or short-term care stays if, say, your family or your client is leaving a rehab facility, but you don't feel like they're ready to go home, and maybe they won't ever be ready to go home. A trial respite stay at a senior living community is a great option, so I can help kind of coordinate that process. And I do senior living community searches and placement. So walk through the process of, I'm not exactly sure where I want to go, if my mom can go, if she's willing to go, if she can afford to go. Let's talk through our options. So we kind of can sit down and do an assessment and evaluate, the next steps if staying in your home is no longer an option and moving into a community living situation would work best for you. So we basically kind of do a lot of everything, kind of what it takes to support the client. So some people that might need a care manager or senior living advisor, if the person has medical or psychological issues, is in need of changes, or is unable to live safely in their current environment, is not pleased with their current care providers and requires advocacy. So say somebody or your loved one or a client is in a nursing facility and they're complaining that they're not getting the care that they need. So we can step in and kind of work with the nursing department, work with elder affairs, whatever we need to do to make sure that they're getting the right care that they're deserve, and kind of step in as a middleman to kind of be a buffer and make sure that they're getting what they need. And also if it comes to the point where it's not able to be fixed in that situation, we can help them find an alternative situation. Many people are confused about their own financial or legal situation. I always try to start when I first meet my clients and make sure that they have all of their legal documents in place. If not, I like to connect them to a local attorney to make sure that they are on top of, make sure they have a healthcare proxy, a power of attorney if needed, that everything's kind of in place in case of a crisis or emergency situation. Again, has limited or no family, or family lives at a distance, or somebody who is newly appointed to help someone, a family member, and they just kind of don't know where to start. So say all of a sudden your father ends up in a rehab, he fell and broke his hip, and now you're kind of, as a child or caregivers, coming in and deciding, now what's the next steps? What's best for dad? Let's talk about this. I need help making these decisions. So we can kind of come in as a support system for that. And a lot of times see this very often, that a caregiver is burnt out or confused about care options. So we can kind of step in and take away some of that burden and stress and give them hope that, we can walk through the process with them. Again, the family has limited time or doesn't really understand the disease. And a lot of times we work as a neutral, kind of a third party, sort of like as a mediator for families to kind of bounce their ideas off us, and we can give honest feedback to be able to allow them to make the right decisions as a group for their loved one. Or if they need education, like I mentioned before, I love to support and promote local education, even nationwide programs that are offered, support groups that are offered for caregivers. And again, if they're seeking senior living community options because they're no longer safe at home, or they want increased socialization, don't want to care for their home anymore, don't think they can handle the maintenance of it and the housekeeping and all of that, and are looking to kind of downsize and get into a community. So I hope I'm not talking too fast. I always like go all off, but so
well, yeah, if you go through it, then what we'll do is we'll just, people I'm sure will have questions. So
okay.
Yeah, you're good.
Okay. So who pays for aging life care or geriatric care management services? Like I said earlier, most of it is a private pay situation. And the cost is, it varies by, whoever is offering these services. A lot of times it's a per hour or per service charge. The per hour charge, I'm sure, can range anywhere from $100 to $200 an hour, depending on the services that they're providing. Different, care plans might have set rates. There might be retainers. So each, a lot of the local care managers are small businesses and local, and I'm sure many can be flexible, as are we, and we're willing to work with our clients to kind of figure out what's the best situation for them, and to accommodate their budget and be able to determine if we can help them help them get to their goal within their means. So I know the price scares a lot of people away because it can be an expensive thing, but at the same time, the relief it can provide to a family, and like I said, the flexibility that most of us can do, that can help make it an affordable option. Also, sometimes long-term care insurance policies, like I mentioned before, will cover the service. And I said, we can do policy reviews to determine if it would be covered. And I have had a few clients through the caregiver support grants through local aging service access points. So that's kind of less of an option, but it is an option, especially for caregivers who are kind of at their wits' end and they have nowhere to go. And so sometimes that can be an option as well. So help navigating the aging process. So as you know, the aging process is complex and unique to each individual. And there are many resources available. And so what we try to do is refer to trusted local industry professionals, and we can also refer to professionals across the country. There's a big group of people that do aging life care management that can work together and help each other. In case somebody was moving from California to Ruth's house, we could help with that process and get them here and coordinate all of their services to make that a smooth transition for them and their family. We can also help understand basic legal documents, insurance, Medicare, Social Security, VA benefits, housing options, and provide resources and referrals to those agencies that specialize in each of those areas. So I'm sure, as you all know, the aging population, or the population is aging rapidly. By 2035, 30% of Massachusetts will be 60 or older, which is a lot. And it's this graph here kind of showing that older adults are going to outweigh children, not outweigh, I guess, outnumber children relatively soon. So it's very important to understand that the aging life care, or the aging process, is changing, and the care for them is changing. As we all are aware, I'm sure right now, of the caregiver shortage, um, and trying to find the right people to care for our older adults. So I see, that I don't have an answer to this problem, and it's nobody. I don't think anybody does, but it's kind of a work in progress. So I feel like everybody who works in senior care, our goal, our job is to work together to help the seniors and their families in whatever way we can, to navigate this care process. So as a aging life care manager, kind of helping put the pieces together with the help of all of you who also do similar work, is so important. And I think it's the only way to get into, to be up with the changing landscape of senior care. So, and a lot of our older adults right now have children who have children, and they're called the sandwich generation. And helping them kind of manage their families, their children, even their grandchildren, and their parents' care, and working full time, and kind of putting all the pieces together again, is so important. And that's why I think care management is, it's all of our responsibility, and then to kind of put the pieces together to help everybody. So let me go through to the next slide. So I just wanted to share a couple quick success stories of some clients that I've been working with, just to kind of give you an idea of what we can do, or what we are doing on a daily basis, and just the things, each situation is different, each client is different, and that's what's really great about it. So we can kind of work to help determine what your specific needs are, and kind of move forward from there. So I'll just go through a couple quick little stories just so you can kind of get an idea, and then after, that'll be pretty much it, and we'll kind of go through if anybody has any questions. So one of my clients is in a rural town locally. She has in her 80s, and she has dementia, definitely moderate to severe dementia. She lives with her adult son, who has who's had a brain injury in his younger years. So he's caring for her. He's our caregiver, but he is having trouble managing it all. Her other family is concerned regarding her happiness. She's in bed all the time, not eating that well, not ambulating, not showering, not bathing. She does need support with most of her care. She's starting to get agitated and depressed. And so the family asked us to come in and kind of do an assessment and care plan, and develop and determine what things we can do to help. So basically I went in for an assessment. I looked at what their home needs, some repairs, some safety advice. So I kind of put it together in a care plan, presented that back to them. So now they can use that information as a roadmap moving forward. And these are your options. These are the different things you could do. Maybe an assisted living, maybe an adult day health center, maybe more increased home care, maybe a home modification, a safety evaluation. So there's a lot of different things in that. And so I can help them kind of implement the plan that works best for their family. Another client, she needs live-in care placement for her mother, who lives in Eastern Mass. And so we were looking and trying to find somebody to be a live-in caregiver. So we kind of just coordinate that process, help the family make a determination on who the best options are, interview the potential caregivers, and kind of set that up and ensure that, that they're getting the care that they need. Another example, as a senior living advisor, I have a couple in their 90s, a husband and wife living independently, having a few hours of care coming into the home. The husband has been taking care of the wife, but she's suffering from Alzheimer's, and she is getting, obviously it's progressing. So he is exhausted caring for her, but he has guilt. So basically working with the family and, to get them to try a different option that might work for them. Suggestion of maybe an assisted living with a memory care component, so that they can still live together and help each other, but also he gets independence again, he gets his life back, and she can have the proper care and socialization that she needs. I'm also working with another client who is in her late 90s. She was in a rehab facility in a nursing home, but she's not able to go home. She's been there for a long time, and now she's private paying about $14,000 a month, but she's not happy. So we were able to get her into a community where she can, an assisted living community where she can be more of a home environment and still get the care that she needs for much a fraction of the price. So I also, one other thing I'll mention one quick, another client that I'm working with always lived alone, has developmental disabilities, in his 80s, helping him kind of, with all his needs, coordinating his doctor's appointments, changing his address, bringing him to transportation, being a companion for him, making sure he has everything he needs, and talking with his doctors, basically just kind of being the boots on the ground family member for him. So there's a lot of different options of what care managers can do. And it's not just black and white, it's all gray. So there's, so I just wanted to kind of give everybody an idea of what we do, and kind of see if there's any questions for that. So basically at Tucked In Elder Care, we offer a holistic approach to caregiving and care planning. So as I said, we tailor our service to address the evolving needs of each client and their family. Each member of our New England-wide network is aging life care professional, is credentialed and highly skilled in managing every aspect of living, planning, and caring for older adults. So Aaron,
Nice.
who's this picture here.
Oh, wait a minute. Let me go back. Sorry.
No worries. Aaron,
There we go.
in the picture with the woman with the red or the purple sweater, she's the owner of Tucked In Elder Care. She's wonderful. And then that's a picture of my grandfather and I before he passed. And it's just wanted to share that because it was special. So that's that.
Nice.
So thank you guys for listening, and I hope I kind of gave you guys a better idea of what it is that we do. And if you have any questions, I'd be happy to try to answer them.
I'm going to stop sharing now. And then, one of the questions that I have, and I know that there's a couple of folks from the ASAPs, the local ASAPs. Oh, and I got Toby asking a question. All right, hang on, Toby. As far as the grants, because that's what I was thinking of, right? That private pay mostly, or some of the long-term care insurance policies, and you could actually go over, you could look at the policy itself and see if it's covered. What kind of monies are available from the ASAPs? Is it few and far between, or what? Lydia, you're on, and then I don't know. I know that there's a couple people from Greater Springfield on as well. Is there anybody that can share the kind of monies or what we need to do as far as to apply for that? Lydia, would that be you, or would that be somebody else at West Mass Elder Care?
Sorry, I was trying to. So through West Mass Elder Care, so I think maybe through the caregiver grant might be able to provide some like financial support. But as far as like home care programs, we coordinate with other, contracted providers to provide those kind of services, and we have the case managers. But if, and again, like through the caregiver support program, perhaps that, might be able to provide some grants, funding for that.
Okay.
Yes, that's where I've seen it, through the caregiver support. So not for the client themselves, but for the caregivers who need the support of a care manager to help coordinate their services.
Perfect. Lydia, thank you. Toby, you've got a question. Unmute yourself. Yeah, perfect.
I am so unmuted. Excuse me. Thank you for the presentation. It was wonderful. What kind of paperwork do you need from your clients to be able to do some of the functions you do, to check on things, to set things up, the medical? Do you need a power of attorney? Does the question make any sense? I'm wondering, because you can't just call anybody up and say, I'm scheduling an appointment for so-and-so, but who are you?
Yes, exactly. So if we work with the care manager, or as the care manager, we have an agreement with our clients who basically give us, usually the client is the power of attorney for the client, or it's the client themselves. They give us the rights through in our agreement to be able to access that information, and then HIPAA, through HIPAA, they sign HIPAA forms and everything like that to be able to get that information. So it's individual again for each client, but we have the processes to be able to work and get that information.
Thank you.
Katie, there's actually, so Lisa is one of the ones from Lisa Pio from Greater Springfield. And she says, contact the INR department at Greater Springfield Senior Services, and they will connect you to a care specialist to discuss options for grants. So anybody in the Springfield region for who's through Greater Springfield Senior Services versus Lydia's at West Mass Elder Care. So that's good. So it's a care specialist discussing options for grants, which would be great. All right, so we've got another one. Zoraida, you have your hand. Oh, and then after that will be Lisa. Yep.
Yes. Hi, everyone. Katie, great presentation. Thank you for all of the information. So I do have a question because I know that you mentioned that you provide services as far as private pay to assist with doing some financials for the person. So with the PACE program, we help folks qualify for math help, and sometimes some of the elders that we work with don't have the capacity to get like all of the finances in order. So is that something that I could refer to you? And you know, the situation here is that I know it's a private pay option, but sometimes we do work with people that are very low income. So this would be a great grant if like an ASAP can create funding for someone that needs this kind of assistance with helping with finances, and could probably, you know, funnel that through a care management company like yours.
Yeah, I like that idea, and absolutely we can help kind of grab, you know, get all their financial pieces together and kind of make sure that they would qualify. And again, you know, the rates are private pay, but you know, in certain situations we can be accommodating in certain ways to make it work. But I do think that would be a wonderful way to get money funneled through to be able to help people, especially on getting onto the PACE program and that sort of thing.
Right. So I'll reach out to you to talk to you about this specific case to see if this is something that you could look into and see if this is a you know,
thank you.
Work with. Thanks.
Perfect. Excellent. Lisa Pernice.
Hi, thank you, Katie. You mentioned the rough cost per hour, a range there. Do you actually, I work for a non-medical home care company, so we provide that extra care. So do you actually hire the home care, or the, you know, how does that payment happen? Does it go through you? You talked about attorneys and that sort of thing. How does that work?
Sure. So we would refer our clients to the agency or whatever source and let them we could kind of be the middleman and help make sure everything, all the pieces come together. So they would pay you directly. We would just make sure that everything is being done the way it should be, and manage that care level, and kind of just, if we implemented a care plan, kind of work with the agency to make sure that they're implementing the care plan the way that the family wants to and everything like that. But yeah, they would just pay you directly. So it's more of just like the middleman situation.
All right, thanks.
Great. Does anybody else have any other questions? I mean, Katie, we love working with geriatric care managers. Of course, you know, Christina and Susan can attest to this. A lot of times we find family members, like I was saying during my presentation, just talking about the dynamic sometimes between the families, where if they don't get along, or if, you know, the son thinks, you know, one way and the daughter thinks another, and then all of a sudden it becomes there's like animosity in between the family members. And we recommend, it's like, you know, maybe talking to a geriatric care manager, because then you got to get back to focusing the care that you really want back on the elder, as opposed to what the brother or the sister want.
Exactly.
Yeah, it gets hard sometimes, but we're really glad that we've got folks like you that we could refer to. So thank you very much for that. Anybody else? Any other questions for Katie? We've got a little bit of time. No questions. Katie, you must have covered everything perfectly in your presentation. But of course,
I have one more question, if I could ask.
Sure.
Katie, do you find the cost is a difficult challenge? I know in home care we do.
Yeah.
And I always tell people, I wish everything were free.
Yeah.
You know,
I know, and I feel the same way. I'm always trying to find ways to work around to be able to help people and make it work that isn't always cost prohibitive, and some, a lot of things, obviously I'm newer to this business, and I'm kind of just starting out. So mostly everything I've done so far has been free or very cheap. So a lot of it, not everything, but a lot of work that I do so far has been, I'm giving it to people, and I'm using that as a learning experience for myself, but at the same time, I know it's a business and I need to make a living. And so I'm trying to figure out the balance between that, because it is an expensive thing. But once people start using it and realize that the benefits of it and how it can free up their, life and time, and give them back that time with their family and their loved ones, that's the most important part. So, but yes, that is something that I do find prohibitive of it.
And especially, I mean, if there's a family member that is having difficulty, you could always send them to their local ASAP, and
Yeah.
hopefully there'd be grant money available, which would be spectacular, right?
Exactly. Yep. So hopefully, everyone can at least find some way to get at least a little bit of service and help. And I'm always happy to even refer people on to other people that can help, regardless of if they're my client or not. If they need something and I know somebody that can help them, I'll point them in the right direction, as I hope everybody does as well. So
Of course, yeah, it takes a village, really, right? We're dealing with the elder population that's only growing. Like you said, I mean, I can't believe those statistics. That's we know that the baby boomers are just kind of it's a continuation, but wow. So this is good.